Hello everyone, today I'm taking about standard practices and additional precautions of infection control to keep you and your patients safe. Let's get started with the basics, known as standard precautions. First up, hand hygiene. Clean those hands thoroughly and often. It's your first line of defense against spreading infections. Next, personal protective equipment, or PPE. Depending on the type of exposure, you'll need gloves, gowns, masks, eye protection, or face shields. Suit up to stay safe. Third, respiratory hygiene or cough etiquette. Cover your mouth and nose with a tissue or your elbow when you cough or sneeze. Dispose of tissues properly and remember to wash your hands afterward. Safe injection practices are crucial. Always use sterile needles and syringes for each injection. Never reuse them. Don't forget to clean and disinfect surfaces regularly. High-touch areas like bed rails and doorknobs need frequent cleaning with appropriate disinfectants. Sharp safety is a must. Handle needles and other sharps with care and always use puncture-resistant containers for disposal. Proper waste disposal is essential. Dispose of contaminated materials in designated biohazard containers. And lastly, patient placement. Isolate patients who may contaminate the environment or pose a high risk of transmission. Now, let's talk additional precautions for known or suspected infections. For contact precautions, use gloves and gowns and isolate the patient if possible. Disinfect all equipment thoroughly. With droplet precautions, wear a surgical mask within 6 feet of the patient. The patient should also wear a mask when being transported. For airborne precautions, use N95 respirators or higher and place the patient in an airborne infection isolation room. That's a wrap on Infection Control 101. Stay safe out there and keep making a difference. Catch you in the next